My name is Mary Dawood. I'm a consultant nurse in emergency medicine at Imperial College London, and I'm very privileged to have been asked to speak about end-of-life care for older patients in the emergency department. I feel that we don't actually do this nearly as well as we should, and I have real concerns that the last few hours of somebody's life, if it isn't good, is devastating for the family, which is why I feel we need to really up our game in this area of practice, particularly as so many of our patients now are over the age of 80, even over the age of 90. They are the majority of our patients that we see. We don't traditionally train our ED clinicians, nurses and doctors in end-of-life care or palliative care, and there is kind of a mismatch here between the whole concept of saving lives in the emergency department and actually looking after people in the last few hours of their life. I think the context of my session has been very much around what we can do to make end-of-life care better for patients and for their families. And this is all underpinned by a couple of things, and that is respect for the humanity, the dignity and the privacy of that person, and also to pay due respect to their ethnicity, their cultural background, because these interplay with how they would like to die and what they consider as a good death. I think there are lots of issues that are perceived impediments to good life, a good end-of-life care in the emergency department, such as crowding, volume of care, 4-hour targets, etc. The list is endless, but I don't think any of them are good enough excuses for not giving the person the best possible death that we can. I think we need to change our attitudes towards death in the emergency department and not see it as a failure, but see it as a success if we actually manage to make that person's last few hours as comfortable and as dignified as possible, and that we support the family in their very first steps in grieving for that person.